another familiar face, Forbes, McGain, onto stage. Here he is. Yep. Now, Forbes is an anaesthetist and intensive care physician here at Western Health. He's been so for the last 12 years. Forbes enjoys being involved in research, teaching and education at the hospital, university and beyond. Forbes remains passionate about making seemingly small environmental, financial and social sustainability changes to how we practice medicine that become magnified through every nation's hospitals. Please join me in a warm welcome for Forbes McGain.
Thanks, everyone. So, excellent talk by Dr. Coe. Really enjoyed that. So, we will race through a little bit of the story of carbon footprints and get onto what we actually do about it. I often show this slide to start with, and people have seen some of these slides before. Don't answer, but do we know where we are at the moment? What's this place? Where want we be in the world? Hawaii, very good. There are the telescopes, and you're looking. That's on Mauna. That's on Mauna Kea, and you're looking back at Mauna Loa in the background, and you can just make it. So we're looking back now at the previous mountain. You can see the little white dots up the top there. I think the little mouse there, little mouse. So they're the telescopes. So the first mountain's looking at the universe, and this mountain's looking at us. And so you probably, many of you have seen this curve before. It's the Keeling curve. Charles Keeling started in 1958. And you can see that beautiful swing of CO2, a living planet. It's only swings because we're alive because there's photosynthesis going on. And you can see that gradual rise. The 3 hours giving you what the increase was in the 1960s, 70s and 80s, and then you've gone to 80s and 90s, then you've suddenly gone to the 90s and 2000s and beyond. And in fact, we're increasing still. So last year was the greatest increase of CO2 that has ever occurred. It was 3 parts per million, and so we're up to about 414 now. So it's actually increasing, not going back. So we're in trouble. So what was interesting is that health, I think it's really starting to get momentum now, and we'll go through about how we can increase that momentum. But to suddenly see the premier journal of medicine, New England Journal of Medicine, publishing only last month, Climate Interactive. It's a great site, just worth looking at, as opposed to those horrendograms that we heard Mark talk about before. This one is the Americans, and they keep it simple and nice. I really quite like it because you can just click on each one of those areas and you can find relevant links to problems and trouble associated with it. It's cardiovascular disease, respiratory, gastrointestinal, or anything else. And also along with that, they're very nicely given on the interactive, the healthcare delivery issues that can be improved. First of all, that things that are damaged, like costs, utilisation, disruptions of care, and public health worries, but then also things that health systems can do in a nice, simple sort of way. We're going to talk more, of course, about carbon footprints, but all of those things are important for adapting and mitigating. So this is perhaps what I do. I work in intensive care and anaesthetics, and you can see I've got my little defibrillator down there. It's not very useful with actually trying to deal with the underlying problems there. Oil, coal, alcohol, cigarettes, red meat, all good stuff. So we're in a bit of a tight spot at the moment. And I don't think that my normal intensive care and anaesthetic workers are actually going to pull us out of this trouble. We need to do something a bit more radical. So we're going to go through a bit more about healthcare, and it's the important polluter. Consider what we can do about it. Know what we're doing about it with some of my own lessons and troubles that we've had along the way, and what are the barriers presented to us, as well as going on and actually doing something about it. Because, I can do what I like at home, but it's only one home. And what I do at work already, for those who know what we've been up to at Western Health, turning off one steriliser a day will actually be 10 houses worth of electricity and water that you've turned off, just using it more efficiently. I'll never own 10 houses. I'll negatively gear none of them. It's things that you can do at the hospital that is far exceed what you do at home. It is good to be doing things at home, but work does matter more than home. And this is our study which preceded the lovely description of the world carbon footprint, the Australian healthcare's carbon footprint. We've got together with Scott's in the audience there, who'll be speaking next. We've also got Arunima and Manfred from Sydney Uni. What we did is followed on what the work of the good folk in the US and the UK have done, is that we said, well, we better work out what the footprint is for Australia. Now, I am going to race through this because I think in the interest of time, there's no point in repeating what the previous speakers sort of talked about. And I'm sorry, I'm just going to race through by saying that when you do this, it's not too hard to do. It's just a matter of getting, this is the easy part. This is how much money is spent by the Australian Institute of Health and Welfare. So you need to, it's broken out into different areas. You've got hospitals, public, private, primary health care, non-PBS, so pharmaceutical benefit scheme, and non-PBS drugs, for example. You've got all those different categories of healthcare, and each has a dollar value assigned with them. That's delivered by the Institute of Health and Welfare. But the missing link was always just getting some information from Sydney Uni. They've got a the Industrial Ecology Lab carbon footprint. So they were around, and from the Australian economy and its 360 sectors, economic sectors, they were able to assign a CO2 footprint associated with each sector. So it could be down to the point of, say, sheep, wool versus beef versus goat production, for example, versus corn, just some agricultural ones, for example. So they're able to come up with an intensity for each area. And of course, within healthcare, not that it's all about goats and sheep, but you have a lot of feeders into healthcare that are important for working out what the carbon footprint of healthcare is. So then you link the bridge, as we called it, as a matrix bridge, and it gives you a total amount. Now, this is quickly going through it. You can see you've got your public hospitals, private hospitals, and other medications, just examples of some of these sectors. There were 15 that were important to healthcare. What I wanted to show you, though, is not so much, it's just that, once again, we're seeing that the direct amounts, the total amounts don't matter too much. I mean, they do obviously in CO2 emissions, but it's the actual story, again, is that it's the total amounts, and the indirect amounts are much more than, like, they're 20 times as big as the direct amounts. And that sort of fits with what we've been showing before in other studies, that it's all the other stuff that we buy. And we sort of intuitively know this. Yes, there's a lot of electricity being used for heating and lighting and air conditioning, but there's a hell of a lot more that's being used for stuff going into and out of hospitals, whether that be just a plastic syringe, a paper, or a new MRI scanner. What we did, drilling down a little bit there, you can see that if this is taking the different sectors of healthcare, you've got general practice, industry, et cetera. You can see general practice is only a small part of that 7%. Another way of saying it is like South Australia. So the state of any South Australians here? No South Australians, no polluter. So South Australia is about 7% of the population of Australia. And so it's every airline ticket they make, every car they drive, every food that they eat, all of the electricity they use, everything that every South Australian does is equivalent to the carbon footprint of healthcare within Australia. So it gives you a bit of an idea of it. So it's important. It's not as important as we know cement making or agriculture, but it is important. And what I wanted to show you that general practice is that it's only a very small part of that 7%. That sort of makes sense because general practitioners, they're doing a lot of good things, but they don't actually leave the lights on all day, and they're not using sterilisers, and they're not doing operations, etc. But they're very important in preventing the carbon footprint from being bigger than what it already is in preventive care. I mean, I've always been very much in favour of preventive care, of public health, because preventing one smoker from smoking is going to do a hell of a lot for the healthcare system, for that patient, for the society, and well and beyond. And what I would say is that, as expected, public and private hospitals being the big part of the pie, was where all the action happens. And the green, we separated out pharmaceuticals because they're a big one. And so you can see that even though it was the green, a lot of pharmaceuticals are being used in hospitals, we tease them out. And pharmaceuticals alone are 20% of that 7%. So they're a really big number. So don't waste your drugs. But we do, as Grace and the pharmacist we've talked about. There's all sorts of projects we've involved in reducing the amount of wastage of drugs. But they're very important. That's one of our little lessons from this. This goes with the UK study. They also showed that procurement was a big part of the story. So green being all the energy use directly, but a big part of the story, once again, being procurement. So then we come to the more important part of the story. What are we going to do about it? It's large, but we're healthcare. Climate change is a health problem. We have, in Victoria, carbon neutral legislation by 2050. Do we have a plan? We could. Yes, we've got a plan. I just don't feel as happy as these people. That's the sad thing about it. I just don't. I can't feel that happy. But we've got this, as we've heard before. Numero uno, the number one in the plan, which has been very nicely prepared by the Department of Health and Human Services. Great work by the team there. that tackling climate change is number one. It's ahead of everything else. And in fact, when you look along here, all these other things are actually improved. If you improve them, you improve your carbon footprint as well. Reducing violence, stopping drug-related activity, all that sort of stuff. They're all secondary things that we can do to try and reduce indirect environmental sustainability. We've also got the participation. We've got emissions reduction pledges. We've heard from the TNRs. At least 5% of hospital electricity we source from on-site renewables. That's 11 gigawatts. It's a big number. It's about half of Sunshine Hospital. So around about half of Sunshine Hospital is equivalent to all of it. That is our target by the end of 2023. Our target will be about half of our hospital you're in right now. And we have a strategy. Yes, we've heard about the strategy. It's been a good strategy. And we've heard from, I don't know if you're aware of this, but your previous, not Jenny McCarthy now, but the previous health minister said, look at this, it's important. We need clear linkages. We need to do something about it. Demand grows. This is really interesting. I thought this was really interesting. Here it is, bang. 2005, increase in healthcare's carbon footprint, increase by 1/3. So Victoria itself is pretty static, but our healthcare is worse than everything else because we are increased. We're up by 1/3. Everything else is about the same, but no, climate change is a health issue. Don't forget that. So I put it out there that yes, it is great. We've got a Climate Change Act. It's showing real leadership. But the South Australians were there 10 years before us. And interestingly, the Swedes have been there since 1990, and that was massive. We're the first country to get rid of a carbon tax. We're the world leaders. But then it's got rid of $139 a tonne. So Sweden is just transformed. Transformed. It shows you what you can do. This shows you what you can do as well. So this is what MONASH is doing right now. So they're going to be net carbon zero by 2030. As well as that, you've got the banks, you've got Commonwealth Bank, you've got National Australia Bank, you've got the Melbourne City Council, you've got solar trams, you've got 11 new councils on a new plan to be carbon neutral by that sort of period of 2025, 2030 as well. So it's happening. So we're going to have to issue, haven't we? We're suffering. We haven't seen anything about suffering yet. Healthcare does pollute. We've heard from the previous speaker and the rest of them. But it's me that's the problem. I'm the problem. We're all landlords. We're not up there with the banks, or the telephone companies, or the water utilities, or the health councils, or the universities, or our homes. We can influence lots of good things in scope 3, as we talk about, buying stuff. I think there's enormous scope for doing things there. I think it's really, really important. But that's not really, it doesn't fit, as we've heard, within the remit of what we've got to do in Victoria, because that's outside. It's irrelevant. Because all of the stuff that we buy, all the plastic syringes that come from Japan and the Philippines and China, for example, it's all relevant. It's not included in that. Don't ever forget that. So we have to do something about what we can currently do. And that is only doing in hospitals what we can. It's what should be done. I think that certainly shows the UK has led an absolute guiding way here. 80% increase in activity, 11% reduction, so about 1% per annum dropping. New Zealand, I think, is a really good example where it makes it easier if you're already based on renewables. They've got geothermal and solar and wind, particularly hydro. Tasmania could be a land of reusables as well because they've got their electricity is not based on brown coal like ours is. It's based on 1 minute. Okay. So it's more difficult. I think that what I will say is that we do have a procurement. We've seen with Jefferson Hopewell, good friend. There's all sorts of good things that can be done, but I wanted to show you a barrier where we tried and failed. It's not all about the federal government. No, it's about us. It's about the CEO, it's about the board, it's about doing things together. And it's interesting that long-term renewal contracts save money because that's why the banks are doing it. Sorry, I had to put it in there because they wouldn't be doing it just for a bit of PR. It takes a lot of work for power purchasing agreements, as we've heard from Jenna. It takes a lot of work, but it can be done. We have more barriers than these because we've got to deal with other outside contracts. We also have to deal with health purchasing Victoria. We wrote to the CEO in March, can we please have renewable energy? No. No, you'll need a ministerial approval. You'll need to go around us to do that. There was a tender, but it didn't happen. But it went to the banks. So I got wrong there actually for another 4 years. The contract is for 4 years. So we are on brown coal. All of you are on brown coal for another 4 years, whether you like it or not. You can feel the end. Unlike them. So I think we need to do things. I think we're working at Western Health. It's going to be hard yards. It's not going to happen overnight. The new Footscray Hospital is going to be exciting. I'm pleading. We've written to ministers about this, about saying we need a sustainable hospital. This is going to be around for 50 years. Decisions made now matter. Decisions made in 2050 are irrelevant to climate change. It's far too late. What we have to write, petition, query, pester, cajole. Why isn't healthcare leading the way? Because this climate crisis is a health crisis. Why bother? Because now matters. These ideas and changes are minor, but they are generalisable. That's the thing about it. If you do it in one hospital, you can do it in any hospital. That's my email address. Go forth and write.
Thank you, Forbes. He's here available now to take some questions. We do have a few minutes. Oh.
Yeah, it's interesting. So that relates to the method of input-output is tricky, and it probably relates to, as Jen was talking about too before, that he said that Victorian healthcare is 1% of the footprint of Victoria. And it relates to how encompassing that information is. So although I don't have access to the method per se, so they use something called EORA. It's a different method of obtaining data, but you can imagine there are differences in how encompassing of the entire footprint you can be for an economy, and it's tricky. Yeah. So. And we have the Australian Institute of Health and Welfare data in this one. Yeah.
Questions? Down the back. Yep.
So the contract is a 4-year. So the contract for all Victorian public hospitals is 4 years of brown coal, the grid, well, it's 80% brown coal. And we want an exemption from that to be able to have an electricity provision which is more renewable electricity. Yes. Yeah. It's not easy. Just like when you go, if I want a particular type of, cath lab device, for example, for a cardiologist, they may not be able to provide it. Sorry.
Thanks, Paul. That was great. Do you have a particular source for your information?
Which information?
Information about climate crisis.
So there's a lot of different sources. I mean, you'd have to give me a specific question. Yeah. So for example, like the climate change at the beginning of the slides, that's all from National Oceanic and Atmospheric Administration. Is that what you're talking? It's a wonderful website, the American NOAA. It is. It's a great source of information, actually. But other more, the information about life cycles and things like that, it's more just our work, but it's published. Yeah.
So we have time for one more question. I saw, okay, the lady down the front. But
No. And they've got to do something about it.